Hello and good afternoon once again. Dr. Alalade here, and tonight it's an open show. We'll be opening the floor to general questions and general gynecological stuff to ensure that we answer as much as questions as we can. I want to welcome you to a new week, first of all, and I want to introduce myself as Dr. J to everyone. And I'm so happy to be here. I'm so delighted to be here. It's been a busy time, and over the weekend we had a seminar, our August seminar. If you did not attend that seminar, you missed a lot. It's a seminar that anyone and everyone should be there. We talked about how to improve the chances of getting pregnant, which is an obvious big topic, and I went through different scenarios to answer people's questions that day. Once again, I want to say good evening to everyone. I'm so happy to be here, and I can see Faith Abidemi or Seni on Facebook here. She's just joined, and all our viewers joining as well on Instagram. Nikelayade, Momo Fati, Lindy Khan, Ukaya Abrazak, Miss Zeberi, Priska 7936, Miss Zeberi. Hello, Miss Zeberi, I can hear you. And once again, I want to say this is Dr. J. And today was a special day, which we opened some kind of a bonanza for our people that want to register for IVF for the month of September. Every month we have people that we package together so that they can go to the same batch for IVF, and we've opened a bonanza. So if you want to take advantage of that, you should have done that today, because we put out all the posters for that earlier in the day. Tonight, I'll be opening the floor and I'll be answering general questions on gynecology. And if you have any questions, please join me. During the weekend, we talked about, ovulation, fibroid, sperm count, what is essential with sperm count, and how it works to ensure that pregnancy is what you get. And we talked about treatment of fibroid, treatment of endometriosis, pelvic inflammatory diseases, how they are diagnosed, and so on and so forth. It was a wonderful time. We talked about how to calculate ovulation, despite the fact that I don't focus on calculating ovulation. We talked about that anyway. Talked about special vitamins that can increase the chances and the quality of sperm, and also reduce the risk, reduce the aging process of eggs. So we spoke about all those things at length over the weekend. If you attended the seminar, you can easily watch the video again on the seminar page. And the video is going to be there on that Facebook seminar page over and over. You can watch it at your free time. I can see Deborah Semande Ochaba, Tetenda, Damian Inena, Uju Obiokoye, Unwodika, Faith Abidemi. I can see Adefalake Kayode, Onikuide, Christina Ladumoye, one of our moderators here on ATG, and everybody coming up live here. Adefalake Kayode, Onikuide, thank you so much. And on Instagram, unfortunately, Instagram names are like nicknames, like acronyms. I'm not going to be able to mention all the names I can see on Instagram, but I will try as much as I can. We have Exo Sugar, Apetamin Weight Gain Syrup, Mona Queen, Hola Pill 1. We have Lady T 1800, Say Babe 226, and so on and so forth. People joining all over. So tonight is going to be an open time. I know tonight people want to ask questions, so just hold on. You have to give me time to listen to questions, read them out, and answer them as soon as possible. Because if I don't read them properly, I'll probably not be able to capture them. And if I miss your questions, because definitely I'll miss questions, that one is guaranteed, because I'm human. As I'm reading, I'm answering questions come so quickly, I can't pick them up on time, and then I lose track. So Fatima Olamiji Balogun, welcome. Ada Obi Ezenka, Idoko, Joy. So there's a question here on this our Facebook page. This wonderful lady is asking about what is the cause and something. Can't see that question. So something like, okay, a doctor, my menstruation flows in the morning, stops at night. What is the cause? And you've done scan, and everything says there's nothing wrong. Actually, Faith, I believe there's nothing wrong. And you see, when you are doing your period, okay, your bleeding will start usually in the morning or maybe at night. It will flow slowly, sometimes with a gauge, then slows down, but continues steady. It might also go up again, maybe in the morning again, slow down for about 2 to 3 days, and it stops, and then it starts to thin out and clear out. So, but if you've done scan, there's nothing wrong. There's nothing you should worry about. Or however, if you want to be entirely sure, what you can do is to do hysteroscopy for us to look into your womb. But from what you're telling me, I don't think there's anything obviously wrong with your period, honestly speaking. So you don't waste your money. So that you don't waste your money. Kafayat Lawa, Amadi Vivian, and Chidima Oji, Vivian Diko Briggs, one of all our moderators here. Amina Bint Ahmad, Ibrahim Ajibola Khadija, and thank you so much. So let's keep on taking those questions now. There's a question here, says, Doctor, after taking Clomid for 5 days and I checked my eggs, was okay. Your period started today, what should you do? So basically, the Clomid might not have worked for you. 2 options. If you've used Clomid about 4 times, stop it. That means that it's not going to work for you. Doing the same thing back to back, expecting a different result is basically not too good. So if you use Clomid 4th time, stop it. Forget it. It's not going to work. You have to move to consider IVF. Now, if this is your first time taking Clomid, my sister, you can repeat the Clomid again under the guidance of a doctor that's looking after you by doing follicular tracking scan, and increase the dose appropriately. Never go above 150. Okay, if your doctor says go above 150, don't. Just stop there. So there are different doses of Clomid. If you've been on the previous dose before, you need to increase the dose, and then so on and so forth. Now, so there's a question here from Oyibo asking that how to treat Staphylococcus aureus permanently. There is no way in the world to treat any infection permanently. Whether it's Streptococcus, Staphylococcus, Candida, yeast, whatever you call the infection, there's no way in the world that you remove weeds permanently from a field. Weeds will come from time to time. You just need to weed them out. Infections come from time to time. You treat them and they go away. So there's no way you can treat an infection permanently in the world, because these infection organisms, they live with us, they come and go. So there's a question here asking about how to treat Staphylococcus permanently. There's no way. You find them, you treat them. There's a question here about what is the cause of offensive discharge when pregnant. It's usually Candida, but it can be bacterial vaginosis, it can be anything. The first thing first you want to do is to take vaginal swabs and see what particular organism is causing your offensive discharge in that pregnancy, and then we focus our treatment on that particular organism. But in most cases, from my experience, one of the commonest infections in pregnancy is yeast infection, and then we examine you. In fact, by examining you on its own, we can obviously see if you have yeast infection, and we treat them immediately without even waiting for the swab result. But so that is basically, it's very common. Yeast is very common in pregnancy. Doctor, I have pus coming out of my left side, pus of vagina for 2 years. You've taken antibiotics, please advise. Say, Paloma White, if you've taken antibiotics for 2 years for a particular abscess on your vagina, that's what you're calling a pus, abscess basically, and it's not working, the first things first is that get examined by a doctor. We need to see where this pus and infection is, this abscess is. We need to decide whether we need to open it and drain it permanently and treat you. So you might need a surgical drainage of this particular abscess. It's also very important that we take swabs from that abscess and know which particular infection is causing this repeat and reinfection in your vagina area. Okay, doctor, you're having Candida infection. Now they are coming fast. I can't read them now. Slow down, guys. Slow down, guys. Doctor, can a woman with hypolactin get pregnant? Would they still? Yes and no. Your prolactin is too high. It's going to stop you from ovulating. We treat it. It comes normal. You ovulate. But sometimes I've seen people who have hypolactin and they don't ovulate. In fact, in most cases, if you have hypolactin, you're probably not going to ovulate. Okay, and if you don't ovulate because of hypolactin, it is not unusual. So therefore, you need to treat the prolactin and then start ovulating. Thank you, Christina. Okay, so doctor, can you prescribe any something? Doctor, can you prescribe any good drug to treat recurrence of Staph Aureus? You're asking the same question, Ego Oyibo, in a different way. I'm not an herbalist, and I will say the same. See, when you say the truth has no version. It's only lies that it gets twisted and asks part 1, part 2, part 3, fiction. When you say the truth, the fact, what it is, there's no other version to it, because it's going to be the same edition over and over and over again. Because that's why they say God cannot change yesterday, today, and forever. God is the same yesterday, today, because God is the truth. Okay, so basically, Staph Aureus, okay, is an infection. There's no way in the world anybody can treat infection permanently, except you want to stop being alive. Therefore, you should treat infection whenever you have it. If you have Staph Aureus, we take vaginal swabs. We know exactly that it's Staph Aureus, and we give that right antibiotic to treat that particular infection straight away. And then you obviously practice proper hygiene in your vagina, not putting all those stupid things that people put stuff in their vagina, all those jabodantes. Stop making your vagina a cookery pot, a baking farm. Okay, follow proper hygiene. Vagina, only husband penis and your sex toys go in your vagina. Nothing, all those kind of things, the concoction they put in vagina, and people don't have respect for the vagina. I'm not saying you, I'm just saying generally. In most cases, 80% of women in the world, they don't have any ounce of respect for their vagina. I don't know why. People assume vagina is just anything to do. Vagina is so precious. See, we all came through there, or at least most of us came through vagina, or maybe C-section. Some people. So vagina is so precious. It's our first passage into the world. But some people just take their vagina as anything. So basically, vagina hygiene, you'll be okay. Okay, that's fine. But if you have an infection, you get it treated. That's just the honest truth. Okay. Can hypolactin result in cancer? No. Ude Stella, hypolactin does not cause cancer. Let's take some questions here on Instagram. There's no question yet on Instagram here. Can I ask a depressing question? Hopefully we'll try and answer. Okay. Doctor, what type of food causes overweight in babies in the womb that should be avoided? Obviously, you eat balanced diet. Any food in the world can cause overweight. Let me tell you the truth. Any food in this whole world can cause overweight. Everything must be taken in moderation and balance. Balanced diet is what is essential in pregnancy. Balanced diet. Again, balanced diet. No specific food will make you overweight. Any food in the world can make you overweight. Okay. Oluwa Shindara, our address for laboratory is in Lagos and it's already on the screen. So go call them tomorrow morning. They'll speak with you. On Instagram, there's a question from Denick Beauty Zone. Is it normal for sperm to be peppery after having sex? No, sperm does not cause pain. Okay. Maybe you had a rough sex, and then during that rough sex, there's been some tiny tears in your vagina wall which cannot be seen obviously. And they are very painful because they are sore. That is it. That's why you need to use proper lubricant, good foreplay during sex, before sex, to reduce all those microscopic tiny tears in your vagina. Can a woman with endometriosis take in or Hoyago glory? Yes and no. It depends on the severity of the endometriosis. If the endometriosis is so bad that it's damaged the tubes, you're not going to get pregnant. But if the endometriosis is not severe, you can get pregnant from endometriosis. It depends on how bad the endometriosis is. Doctor, can you do laparoscopy? Can you do laparoscopy surgery for PCOS in Nigeria? Me, I can't. I'm not in Nigeria. Okay, and I don't even have a laparoscopic setup in Nigeria. I only have hysteroscopy equipment in Lagos, okay, at our ATG IVF center for now. Udoka Israel is asking, sometimes you have low abdominal pain during your ovulation. It's normal. It's usually very common and normal to have pain during your ovulation. It's called Mittelschmerz pain, ovulation pain. Take some painkillers, that should be fine. Doctor, you found out you're pregnant. When can you start antenatal? Once you're about 10 weeks, 12 weeks, start antenatal. Okay? But actually, your antenatal care starts before you get pregnant. You should be having your antenatal care before you get pregnant and all through pregnancy till you deliver. But if you've missed that, you're already pregnant like yourself, start antenatal as soon as possible. Get booked. Okay? You'll be about 6-7 weeks now, I guess. So get booked for antenatal care. We do scan at 10 weeks to know how many weeks you have, and then we'll take it from there. Number one, sex. Doctor, we love you. Number one sex doctor. There's a question here on Instagram. It says, I'm number one sex doctor. I'm a born again. No? I don't know these things. So me, I'm a virgin. I don't know anything about sex, so trust me. Okay, just a joke. Okay, anyway, back to Facebook. Doctor, is it possible to deliver a healthy baby at 35 weeks? It's possible, but it's difficult. It depends on the environment. In UK, here in America, in most Western world, okay, even Nigeria now, with proper care, you can deliver a baby at 35 weeks. Okay, if labor starts as an emergency, and baby can be looked after properly without infection, without GIT problems, without temperature problems, without blood problems, and they are fine. From 35 weeks onwards, it's okay. But ideally, 37 weeks is better. Okay, the more advanced baby is, the better it is for the outcome. You want to talk to me personally, you want to get beleo, yes, go through our premium services. We'll talk to you. I'll talk to you. I will take it from there. But before you pay for our premium services, please be ready to do investigation tests to know whether you're pregnant. And you can do your test for investigation at our lab or any lab that is reputable in the world. I'm okay. But if you want to pay for our services, know that I will need test results from you from any good lab that you are close to. I can't treat people without test results. So before you pay for any of our services, please first of all check that you are able to follow my instructions, please. Okay. On Instagram here, doctor, I'm pregnant and I noticed white watery discharge from day one. You're 37 weeks now. You can still see it. Hope it will affect your baby. So first of all, get examined. Let's see this discharge in your vagina. Is it water from baby? Do a scan. Then we know. If it's not water from baby, that is fine. If it's water from baby, we have to rule out infection and we take it from there. We might even need to deliver you earlier if we find infection there or we are worried about baby. Can you take COVID vaccine at 17 weeks? Yes, you can. Guidance has changed from Royal College. You can take your COVID vaccine even in pregnancy. It's safe. Okay? Doctor, please emphasize on cervical polyp and fertility. Cervical polyp does not cause infertility. It can make you bleed during sex. It can make you, bleed during sex, but it does not cause infertility. Cervical polyp does not block sperm from entering into your vagina. Okay? Doctor, is it possible to get pregnant when it has been confirmed that you ovulated before meeting your partner? It's possible. Okay? That's fine. So let's go back to Facebook here. Let's go. How can you know you are ovulating without symptoms seen? First of all, if you're having regular period, okay, you don't need to see ovulation sign to know that you're ovulating. Okay, I always tell people all the time, people looking for all those nonsense like egg mucus or having some pain in your tummy to know you're ovulating, you're wasting your time. If you have, I'm telling you honestly speaking, you're wasting your time. If you're having regular period, you are likely to be ovulating 80% of time. If you're not sure, go and do your day 21 progesterone. Counting day 21 from the first day of your period, you check your progesterone level. If it's about 15 to 20 or more thereabout, it means that you're ovulating. Doctor, please, my flow is late for 6 days now. Your flow is late for 6 days now. Okay, I can't see that one anyway. That one is gone. If your husband does not sleep with pregnant wife for 4 months before delivery, vaginal delivery, that one is it's so fast. I can't see this thing anymore. If a husband does not sleep with pregnant wife for 4 months before delivery, is vaginal delivery possible? It's possible. Your husband sleeping with you or not sleeping with you has nothing to do with vaginal delivery. There's no relationship at all. Okay? Okay? Good. Can you prescribe drug for yeast in pregnancy? Canesten. Yeast infection in pregnancy, canesten pessary in vagina. If you have yeast infection in pregnancy, don't swallow treatment by mouth. You put the pessary, canesten, clotrimazole in the what? Vagina. Okay? Doctor, what can cause delay of pregnancy when your eggs are growing but no blockage? Maybe the sperm is not good. Maybe this egg is not of good quality. Or probably you're not ovulating. Okay. Back to Instagram. Yeah. What? Please, doctor. Will ectopic pregnancy show gestational sac? We show gestational sac on scan? It can. Ectopic pregnancy can show even baby heartbeat. I've seen some ectopic pregnancy before. There's gestational sac and there's heartbeat. Okay? Alright. Good evening, doctor. Please, what can cause pain very close to vagina? You mean that fix the lap and vagina together? I don't know what you're talking about. Doctor, you had histopathology. Antibiotics and Yasmin was prescribed. Clomid was prescribed for your next menstrual cycle. Will this help in getting pregnant faster? That's fine. It can. If you need Clomid, they're giving you Clomid prescription. They should plan for follicular tracking scan to ensure that you're not overreacting to the Clomid. Doctor, your menses did not come every month. Sometimes like a year. Like this year, it came only once. Is it normal? It's not normal. It's not normal. You see period only once a year is not normal. So let's go back for your case. Chisholm, Simon, Obichele. Go back to the basics. Do all your hormonal profile. FSH, LH, okay, hormone, AMH, prolactin, hormone, ultrasound scan, HSG, husband sperm. Send it to me. Let's look at it. Okay. You've had evacuation for blighted ovum. How soon can you get pregnant? As soon as you see your next period, you can get pregnant. As soon as you feel healed emotionally and physically, you can start the trial for pregnancy. Can a woman get pregnant after treating hypolactin? Yes. If you've treated the hypolactin, you've done your prolactin level after the treatment, it's calmed down, you can get pregnant, certainly. Okay? Thank you guys for watching on Instagram. I can see you all. God bless you. We're trying to ensure that our Instagram channel is getting on top. And we're also on YouTube as well. We put in our videos every week on YouTube, okay? You can watch our videos in sequence on YouTube. Thank you guys. Now, Gloria, thank you, Gloria, for putting up the link. How can one get pregnant with PCOS after treating with letrozole? It didn't work. If you tried letrozole for PCOS and letrozole, clomid doesn't work for PCOS, you have to consider IVF, honestly speaking. Or try again, and whenever you're trying for with regular sex, use pre-seed lubricant. Doctor, can Candida and yeast infection prevent pregnancy? First of all, Godson Chinwendu, Candida and yeast infection, they are the same thing. Candida and our team members, can you put it up on the screen that Candida and yeast infection are the same? And Gloria, Christina, can you help me put on the screen? Type it out. Candida and yeast infection are both the same. Okay? Calling me Babajide Alalade, Dr. Babajide Alalade is the same. I'm the same person. Calling Ewure and goat is the same. Candida and yeast is the same. Candida, yeast, thrush is all the same. Thrush, TH, let me put on the screen. Candida, yeast, and thrush. Candida equals to yeast equals to thrush. THRUSH. Dr. Alalade, Dr. Babajide Alalade is the same. Ewure, goat, Ewu is the same. Different name, different strokes. Case closed. You can treat it in pregnancy with canesten pessary. Bam. Can I get pregnant? So fast. Can breastfeeding mom take COVID vaccine? Yes. My wife is pregnant. She had a baby. She's breastfeeding. She's had COVID vaccine. It's okay. It's safe. Okay. Let's see. Which test help detect if your tubes are open? HSG. Check out the glory. HSG. Thank you so much, Favor Chuku. God bless you. I love you too. You have twins. Wow. Congratulations there. A lady on a platinum service had twins today. A lady on a platinum service had twins. She got pregnant and had twins today. Congratulations to that lady. Can a woman who has done fibroid surgery 6 years ago and fibroid came back 5 centimeters with low AMH get pregnant? Yes. With possible IVF, okay, she can get pregnant. Is it normal to feel baby kicks once in 3 days in 22 weeks? It's possible. Probably you're very busy, but go and get an ultrasound scan done to check baby and check baby's heartbeat and check baby's movement. You want to reach me? Go through the premium services. People have already put. We don't have an app yet. We have it already on Google Play Store, but it's not yet launched. We're trying to get iOS to approve it for us. It's been difficult, but we'll get there. If you want to reach out to me, you can go through the premium services. Lily Batu has already put up the links for the premium services now on the screen. You can click on the links and choose what services fits your budget, and you can get across to me. Okay, very good. Thank you. On Instagram, I can see Strictly Yami Oketon Oluwaseyi. God bless you, my sister. You're doing good. Is it possible to have ovulation and not get pregnant? It's possible. Please advise on resistant Candida. Candida is not resistant. Okay, it's not resistant. It's not an organism that mutates that much. Candida is a fungi. It's a fungus. Sorry, it doesn't mutate like viruses, so it's unlikely to be resistant. It's just that probably that person has a bad or questionable vaginal hygiene, and it makes you prone to Candida. You treat it. Most people that are prone to Candida, whenever they're having any antibiotics for any infection treatment, or maybe they abuse antibiotics, it makes them prone to Candida. So whenever you're taking antibiotics for any infection in your body, you should tell the doctor that you have, or you're prone to having thrush with antibiotics, and they give you thrush treatment, or you get thrush treatment or yeast treatment with conjunction or in conjunction with your oral antibiotics. Okay, is it possible? Bamdele Atinuke Anyola, I've answered your question already. What can be done to a baby that is already big in the womb? If your baby is too big, okay, it's good. I would prefer a baby to be big than to be too small. A baby that is too small means that baby is suffering. Baby that is too big, yes, it's not too good, but it's still better than a small baby. She will check if you have diabetes. No diabetes, fine. We check. Is baby heart beating okay? Blood flow in the cord okay? Good. We might want to deliver you around your due date. We might not want to let you go over your due date. If baby is too big, we'll probably not let you go over your due date. We'll probably induce you on your due date, okay? As far as baby is healthy, the blood flow in the baby's cord is good. There's no damage to placenta. There's no weakness detected in placenta function or baby's movement or baby's heartbeat. We'll let you go up until about around your due date. That is if baby is too big. What causes miscarriage, blighted ovum, blah, blah, blah? We don't know. But One of the things that causes miscarriage, okay, is 1, chromosomal abnormalities. Number 2, infection. Number 3, failed placenta implantation. Number 4, hematoma or bleeding in the placenta. All this can increase the risk of miscarriage happening. What can cause waist pain, leg pain 2 weeks after menstruation? Probably you have endometriosis, okay? Oh, sorry, probably you have an ovarian cyst, okay? You had tubal reversal with clear tubes verified by HSG. Still, do you need fertility medications after more than a decade of having a child to do fertility? If you've had tubal reversal, you're trying to get pregnant for more than a year, it's not working, start thinking of seeing a proper IVF specialist to check your tubes again, okay? Good evening, doctor. What can fasten labor and make baby come out faster? So, are you saying that you're not in labor, you want something to induce labor, or you're saying that you are already in labor, you want labor to be augmented and delivery happen much more sooner? There are 2 different things. One is to induce labor, one is to augment labor that is already in progress. To induce labor, you're full term, we can do cervical sweep, we can try and break your water, and so on and so forth, okay? Some people even have sex around their due date to even go into labor. It can work for them because sperm contains prostaglandins that can induce early labor or make labor start. If you're already in labor, your labor is slowing down, we can augment your labor by giving you syntocinon or oxytocin drip in labor and give it in a slow fashion to get your contractions on the way. So there are 2 different things entirely. It depends, and we ensure that everything we do is done safely, that your baby is not reacting badly to them, okay? We have Priest Woruka, Smart and Fabulous, and Southern Belladonna. Here we have a question from Iwen Duno, Augustina. When a pregnant woman feel noise in the stomach, feel noise, or you mean that when does a pregnant woman feel baby movements? Usually from 20 weeks above. Some will feel it from about 22 weeks and above. Some will even feel it from 18 weeks. But that is it. Dr. J, what causes abdominal pain? What is the remedy? Anything that causes abdominal pain, urine infection, ovarian cyst, appendicitis, constipation, and fibroid. So many things can cause pain in your tummy. We really need to know what is causing your own pain. And once we know what's causing your own pain, we focus on it. So we might need to do some blood tests, ultrasound scan, even CT scan to know what's causing pain in your case. Then we treat that particular thing. Your tummy is too big. I can't say one thing causes pain in your body. Many things can cause pain. Even ordinary urine infection. Yes. Even PID. Yes. Even sex, even endometriosis. This is gynecological point of view. But from surgeons, they will think of appendix, constipation, abscess, so on and so forth. This can cause pain in your tummy. We just need to know what's causing your own, then we'll focus on it. It's okay, Zua. God bless you. Jenny Abe 2018. Thank you on Instagram. I can see you there. God bless you. Now, let's go back to Facebook questions here. What is the cause of painful ovulation? Usually hormonal, and it's safe. As far as you're ovulating, there's no big deal. People do have pain during ovulation. We call it the mid-cycle pain, Michelsmesh in German or in English. Michelsmesh pain is mid-cycle pain, and there's no big deal to it. Some people have it so bad than others, okay? We're all different, and we all talk about pain differently. Pain is very, very subjective. It's not objective, okay? How can I know I have ovarian cyst? By doing ultrasound scan. Or if you're having pain in your tummy and it's not going away despite painkillers, get ultrasound scan to check for ovarian cyst. It's important. What's the solution for delayed conception after a C-section? You've had a C-section before, you can't get pregnant again. What's the solution? I need to know what is causing your infertility in first instance. We call that secondary infertility. What we need to do is to go back to drawing board, do your ultrasound scan again. Yes. Do your husband's sperm. Yes, things can change. Yes, but those ones are not the first thing we'll do. We want to do your HSG to see, is your tubes patent? Are they blocked or not? We want to see, are you still ovulating? Once that has been ticked, then I want to move to checking your husband that his sperm count is okay. Thank you so much. Someone is saying that unfortunately my latest IVF treatment failed. The embryo something. Oh, that one is gone. No. The embryo stopped on development stage 5. It became worse, so no transfer was done. It can happen. It can happen. And it's very sad when people that have gone for IVF, they put their mind, their money, their resources, energy, mindset, and if it doesn't go well, it can be painful, to be honest. But what you need to do is arrange an appointment with the doctor again. Let them go over your paperwork, debrief you to know why the IVF failed, if it's something that can be preventable or treated or preventable in the future. then we tackle that. To know our address to our ATG Laboratories or ATG IVF Center, the address is already on the screen. Vivian has posted it. So if you're asking for our address for our laboratories tomorrow, if you're going through infertility, fibroid, ovarian cyst, you're pregnant already, you want to have your ultrasound scan, you want to book for antenatal, just go to the ATG Laboratories. They'll direct you to appropriate quarters. Or if you want to get pregnant, you've been trying IVF before, it's failed before, just go to ATG IVF Center. Nike, my secretary, and Yemi Beckers, they'll look after you and tell you about the discounts we have, and you can get registered, and you're on your journey to having your baby, your desire, today. Can one do fibroid surgery twice? Yes, you can. You're close to delivery, but there's no breast discharge. Should you be bothered? Whole pill? No. Once baby is out, milk will start to flow. Okay, it's natural order. Once the apple is ready to drop from the tree, the apple will drop. Do you see anybody trying to deliver apples on the tree? No, it's nature. Once it's time for your baby to come out, baby will come and the breast milk will flow. If it's not flowing, people will help you and help you to express, and they'll teach you how to express. Okay, what can you use to boost ovulation? First of all, I need to know what's making you not to ovulate, because once God designs a woman, she's designed to ovulate. So if you're not ovulating, I want to know what is making you not to ovulate. Then I'll focus on that particular thing to know and to treat and to stop it so you can ovulate. For example, if you have hypolactin, I want to get it controlled. If you have low AMH, I want to tell you. If you have high FSH, I want to tell you. I want to go through your hormonal profile to know why you're not ovulating, so I can focus and I don't beat around the bush. I'm not an herbalist yet, and I won't be by God's grace. I'm only a doctor. Okay, how do you know if you ovulate? I already answered that question. If you have irregular periods, you're ovulating. If you're having regular period, you're likely to be ovulating 90% of the time. But if your periods are not regular, then you're probably not ovulating. I want you to do a day 21 progesterone. That's if you've seen your period, you count 21 days, you do the 21 progesterone. That will let me know if you are ovulating. Don't waste your time looking for all those egg mucus thing, all those egg mucus, and pain, discharge, breast tenderness to know you're ovulating. No, all those things are not reliable. To know if you're ovulating, we need to do your day 21 progesterone. Okay? What can cause rashes in the vagina at 34 weeks pregnancy? Probably you got thrush, probably you got bacterial vaginosis. Get examined, we take swabs, we know what's causing your thrush. How can you build up low sperm count? If there's no sperm at all in the sperm, if there's no sperm at all in the semen, then there's nothing that will change anything. Okay, but invariably you can try to stop smoking, no alcohol, regular exercise daily. Those can help to boost the sperm count. And if you have low sperm count, we can give you some vitamins, Fertility for males. We can give you Adizua, or we can give you Proxid. They can help to boost sperm count, but it's not 100% guaranteed. Okay. What causes burning sensation during urination after miscarriage? You probably have an infection. If you're having pain when you're passing water, you probably have an infection. How long can one conceive after a cervical tear? You've had a cervical tear during your last delivery, or for some reason you want to know when you can start to conceive. As soon as your periods are regular and you've been examined that your cervical tear has healed, you can start trying to get pregnant. Okay? Wow. Thank you guys for being here today. I really appreciate you, and I hope to see you soon again tomorrow to talk more about things pertaining to women's health. There's a question here by Mary Blakes. Is it possible to still have some blockage after adulteration? Yes. Adulteration only works 25% of the time. Okay, so if 4 women come from adulteration, 1 will be successful. That means that the 3 is not working. Okay, so you can still have blocked tubes after adulteration. That means that it did not work. It's not going to work in most cases. What causes pain in the bum and leg? Probably you're sitting down too much on your bum. Get up and walk and do some exercise. Is alcohol safe in pregnancy? No. If you try to get pregnant and you're pregnant and you want to start giving your baby alcohol, it's not good though. Then you should go and apologize and ask for forgiveness. You've tried to get pregnant. Some people are trying to get pregnant. They've taken IVF and it's not working. But you got pregnant naturally. You want to start drinking alcohol. You want to start pouring stout in your baby. It's not good though. Stop it though. Start giving God the glory and respect God though. What causes prolonged Candida infection even after taking prescribed drugs? Probably vaginal hygiene. So if you're taking antibiotics anyhow, that can make you to be prone to recurrent and repeated thrush. repeated Candida, repeated yeast. What does it mean for a woman to have floppy mitral valve? That means your mitral valve is weak. You need to see the cardiologist. I'm a gynecologist. Mitral valve is valve in the heart. If your heart's valve is weak, go and see cardiologist. It's not me you talk to. Okay? If you have malaria in pregnancy, treat them. Malaria in pregnancy can cause miscarriage. Malaria in pregnancy is #1 cause of miscarriage in Africa. So treat it. You have malaria in pregnancy, treat it. Treat it, treat it, treat it. Treat malaria in pregnancy, treat malaria after pregnancy. Please, Christina, let me put up a poster on ATG. Malaria must be treated in pregnancy. Malaria must be treated when you're not pregnant as well. Okay? Thank you all. See you soon. God bless you. Have a wonderful day and have a wonderful week as well in advance. I love you all, and most importantly too, I love myself. And thank you so much for spending your time today to listen to me and spending, most importantly, to your data. I'm so happy with this, and this gives me encouragement all the time. God bless you and see you soon. Bye-bye.